Now let's discuss a little about sinus diseases. Now, where are the sinuses? You'll find the sinuses here. These are spaces in the skull. And what's their function? Their function is to produce water and mucus and pour it out into the nose through little apertures at the bottom of these flaps at the side of the nose. Okay, there are flaps at the side of the nose at the bottom of which these sinuses open. And what are the functions of the sinuses? They pour water and mucus in the nose to wash it clean. Okay, because every time you breathe, dust particles, allergens, and all that is hitting the nose. And so the nose needs a mechanism to wash itself. And what is that? What is that mechanism? That mechanism are these sinuses. Now you'll find that at the side of the nose, the lateral side of the nose, there are three flaps called turbinates because they look like the vanes of a wind turbine, of a turbine, that is to say. And you'll find that there are three flaps at the bottom of which these sinuses open. The bottom turbinate is very thick and fat, and it's most often confused with being a polyp. Some people refer patients to us with so-called polyp when we find that it's nothing but an enlarged turbinate. Okay. Now, what is sinusitis? Sinusitis is the inflammation, itis meaning inflammation of the sinuses. Now, how does it manifest? It manifests with a blocked, stuffy, congested nose. Pressure, fullness, or pain in the face because the sinuses are here. Pain in the head, around the eyes. Cold symptoms that never seem to get better. Thick, colored, it may be brown, maybe green, maybe yellow, nasal discharge. Disturbances of taste and smell. Now, why are there disturbances of taste and smell? That's because the nose is blocked. And you see, the nerves of smell come directly from the brain to the olfactory bulb of the brain, from the top of the roof of the nasal cavity here. The nerves are coming out from here. But if you have allergies and these being squished by edematous, that is fattened turbinates, it blocks the nerve, it jams the nerve, and you can't smell anything. That's why you tend to lose your sense of taste and smell if you have chronic sinusitis or if your nose is blocked. Okay, so how do we diagnose it? We will diagnose it by means of a CT scan. Now, I understand that sometimes insurance companies don't like to pay for CT scans or have definite criteria. And at the time of my giving you this lecture, the criteria are: number one, decreased sense of taste and smell, which happens. Number two, pain in the front of the face, sinus headache. Number three, congestion of the nose. Number four, purulent, that is yellow discoloration of the discharge. And of course, chronic sinusitis. And that is when the insurance companies tend to pay for the CT sinus. And what we find when we do the CT sinus, you see these little flaps at the side of the nose are the turbinates. And notice that black is actually air. Black is air, gray is tissue, and solid white is bone. Notice this. This should turn up as black because there are spaces in the skull. But notice how one side is full of this grayish matter, whereas the left side is clear. And notice how the nose is blocked here. This looks like a polyp, okay? And with the one-sided, left-sided sinusitis. Look at this fluid level here. It should be nice and clear like this, but it's not. Look at the nose here. The nose is kind of, the nasal airway is squished because of the hypertrophied turbinates, and also there's fluid here. Okay. Now, when we see these, obviously, we go in for treatment. And what's the treatment? Let's see. But first, let me tell you what the acute sinusitis is and what chronic sinusitis and what recurrent sinusitis is. Acute sinusitis is when the symptoms have been present for less than 4 weeks. Chronic sinusitis happens when the symptoms have been present for longer than 12 weeks, that is for longer than 3 months. Recurrent sinusitis is when there is 4 or more acute attacks in 1 full year. Okay. So what results? Actually, allergies can result in sinusitis. Allergies can actually result in sinusitis because allergies may cause the nasal membranes to swell up, block the passages, and so the fluid here just collects and the sinuses can't pour their fluid into the nose. So these allergies can cause sinus. So it's all linked if you think of it. The allergies, sinusitis, nasal blockage, congestion, eventually sore throat, as we discussed in GERD. Sore throat can all result from sinus issues and allergies. Nasal polyps. Now, what are nasal polyps? Nasal polyps is when the mucosa of the sinuses push through the openings of the sinuses through the little holes here and hang out like a bunch of grapes. That's called polyps. Okay, that's called a nasal polyp. And of course, because allergies are the basic cause of sinusitis, allergies also cause asthma. A person can present with asthma, and then we find that he has sinus issues as well. Okay, so they're all linked: nasal polyps, asthma, allergies, sinus issues. Okay. Now, what about the surgical treatment? Eventually, we have to operate to drain the sinuses. Okay. Now there is surgery. Sinus surgery is called endoscopic sinus surgery, where Dr. Price or Dr. Stacy Morgan will numb up the nose and go in and basically make a connection for the sinuses to drain into the nasal cavity. There is also a surgery called BSOD, balloon sinus ostial dilatation, where a fine probe or a scope is used to expand the openings of the maxillary sinus into the nose. Okay, so that's expand the openings of the sinuses into the nose. So that's called balloon sinus ostial dilatation. Ostium means hole, sinus hole opening to the nose. A balloon goes and increases in size, and opening increases the opening. Okay, so there are 2 types of surgery: ESS, endoscopic sinus surgery, and balloon sinus ostial dilatation, when the openings of the sinuses into the nose are opened up or made to be patent. Thank you.